So, what we're trying to do here is to bring out how difficult it is living with breathlessness. I think many people don't realise that it causes people difficulties, and a lot of people who live with breathlessness, they think that it's quite normal and they just should put up with it and they should keep it to themselves. They can even feel embarrassed about it and they don't want to let anyone know. And yet it has big effects on people, not just, what they can't do so well physically, but it can make them very depressed or anxious. It can lead to changes in their roles and not feeling they're able to do things anymore, and can make people feel quite bad about themselves. And so, as part of our research, we found that it was very, very difficult to live with breathlessness, and yet most people are not aware of this. They're not bringing it forward as something to talk about in consultations with healthcare professionals quite often. And we want to bring it out into the open and make it something that people can understand that there are difficulties, but also that there are plenty of things that you can do about it. There are ways that individuals can manage it, there are ways their families can help support them, and there are many things that healthcare professionals can do to help support people so they can live better with breathlessness. So this exhibition is called Bringing Breathlessness into View, and what we wanted to do was try to make something that is essentially hidden and invisible, something that people can see and feel and hear. And so how can you do that well? Just writing about something or reading something that somebody's written is not effective quite often for many people. It's much better to have something that grabs you, and art and also listening to sound recordings and impressions of what it's like living with breathlessness are much, much stronger. They're visceral. People do look at this exhibition and react to it. They respond to it. They feel something as a result of looking at the pictures and listening to the sound recordings. And it's a way of getting people to be interested in the subject of breathlessness, but also to get them starting talking about things. One person will look at a particular picture and see something in particular as a real message. Another will go, no, look, it's like this, or what does that bit mean? And then you're getting people engaging in a conversation. Some people will say, oh, I've never thought of that. And others go, I feel exactly like that, and it's a way of opening up a conversation, bringing it out into view, making it something that it's possible to talk about and not keep hidden all the time. As well as that, though, I think it was really important for the participants who worked on this to be able to express themselves in a way that often people don't express themselves, by being artistic. One of the participants said, oh, I can't do anything artistic. And yet, talking and working with Rob and Anna, they were able to come up with something which was very, very beautiful and artistic. And it was a combined effort to produce something. And I think that for the individuals involved in this, it's brought them something themselves which has really been special for them themselves and something to be proud of, as well as the wider impact of having an exhibition that is artistic and how that will draw other people into it later. So I've been thinking about this exhibition and wanting it to exist for a long time, and now that it actually does exist, I felt really, really touched by it, by how beautiful I think the work is and expressive, and the sound recordings, how emotive they are, and people's responses when they came to the exhibition opening were everything that I hoped, a wide range of responses, but people were engaged with it and interested. And I think one of the things that I particularly found touching was one of the participants came along with her family, with her daughter and son-in-law, and the daughter had said that for a long time she'd understood that her mum had physical difficulties and limitations, and she would suggest practical ways to help her, but she didn't realise quite how it affected her psychologically. And from this exhibition, she was able to see that she needed to offer her mum much more support, and that she would do in the future, and that it had really touched her, realising that her mum was suffering, but that, this was a way in now, a way of talking about it. So this exhibition has been made in a totally mobile form so that we can take it wherever. The other day we took it to a health practice. We're going to take it to community centres, shopping centres, special events. We'll take it anywhere that people are interested and engage people in conversation about what it's like living with breathlessness, and also let them know through the booklet that we have, the Guide to Living Well with Breathlessness, that there are many things they can do. But having said that, as well as what we do with this exhibition itself, we would really like to work in the future on arts and well-being and how they can be interlinked and how you can improve people's well-being through the use of the arts and also through engaging people in discussion and in relationships with each other whilst producing artistic work.